Today I will talk about preventing cardiovascular diseases, the importance of regular checkups, and screening tests. I'm a doctor specializing in cardiology at Expert Clinic. Make sure to watch this video until the end because I will share the most crucial information on how to keep your cardiovascular system healthy for many years. The foundation of preventing cardiovascular diseases is assessing the overall cardiovascular risk. This risk, in healthy individuals, is the result of the interaction of various factors. There are modifiable and non-modifiable cardiovascular risk factors. I have previously discussed these risk factors in one of my videos. You can find the link below for more detailed information. Screening for these risk factors, such as lipid profile, should be considered for men over 40 and women over 50, or postmenopausal women if menopause occurs before the age of 50. These risk factors are utilized in various risk assessment scales. Currently, in our country, we use the SCORE-2 scale, which considers systolic blood pressure levels, age, gender, smoking status, and cholesterol levels for individuals with high or very high risk. Immediate medication treatment is necessary to prevent cardiovascular diseases. However, it's essential to note that these risk assessment scales are imperfect and require careful interpretation by healthcare providers. In our clinic, doctors spend at least an hour, sometimes more, with each patient to ensure a thorough understanding and accurate risk assessment. It's crucial to allocate sufficient time to calculate and determine the risk accurately based on all available risk assessment tools. Once the risk is calculated and the target treatment is identified, it is tailored specifically to each patient. The SCORE-2 risk scale is designed to assess all cardiovascular diseases, including both fatal and non-fatal conditions like heart attacks and strokes. Depending on the calculated risk, individuals can be categorized into low, moderate, high, or very high risk groups. Understanding this risk helps determine the intensity of medical intervention required. Interventions can range from lifestyle modifications, such as dietary changes and increased physical activity, for some individuals to the addition of medication for others. It's crucial to individualize the approach based on each person's risk profile. If you have ever had your cardiovascular risk assessed by a doctor, hit the like button. If not, consider visiting our clinic for a comprehensive risk assessment with me. Certain scenarios may warrant immediate classification of an individual into the high or very high risk category. For instance, the presence of diabetes automatically places a person in the high risk group, irrespective of their cholesterol levels or score points, due to the heightened risk of atherosclerosis development. Such individuals require immediate preventive treatment to reduce the risk of stroke, heart attacks, and atherosclerosis progression. Additionally, individuals with significant atherosclerotic plaques in their vessels, such as those detected in neck vessels through duplex scanning, qualify for the very high-risk category if the plaque obstructs more than 50% of the vessel lumen. Based on this risk level, the target cholesterol levels, particularly low-density lipoproteins, are adjusted. Sharing this video with your friends can help them assess their cardiovascular risk and understand when medication intervention might be necessary. Now, let's delve into the specifics of cardiovascular disease prevention. Non-pharmacological measures, including dietary adjustments, physical activity, and smoking cessation, play a crucial role in maintaining heart health. Two dietary patterns are emphasized for reducing the risk of hypertension, atherosclerosis, and heart diseases: the Mediterranean diet. Contrary to popular belief, the Mediterranean diet primarily comprises plant-based foods like fruits, vegetables, whole grains, legumes, and healthy oils, with fish consumed twice weekly, lean meats sparingly, and sweets infrequently. Regular physical activity is another cornerstone of cardiovascular disease prevention. I recommend engaging in moderate intensity activity for at least 30 to 60 minutes most days of the week without interruptions. Understanding moderate intensity exercise is key. It should elevate your heart rate yet allow you to carry on a conversation with slight breathlessness, akin to being able to sing a song during exertion. Consistency and dedication to daily physical activity are crucial for reaping the cardiovascular benefits. Quitting smoking ranks high on the list of effective preventive measures against cardiovascular diseases. Even reducing the number of cigarettes smoked can significantly lower the risk. Furthermore, emerging evidence suggests that certain tobacco heating systems carry a lower cardiovascular risk compared to traditional smoking. However, absolute abstinence from smoking remains the best approach for reducing cardiovascular disease risk. Alcohol consumption is a nuanced aspect of cardiovascular health. While moderate red wine intake is a component of the Mediterranean diet, excessive alcohol consumption poses health risks. Alcohol's caloric content, coupled with the tendency for overindulgence, can contribute to weight gain, elevated blood pressure, and other cardiovascular risk factors. If you struggle with alcohol intake, seeking medical guidance for tailored interventions and support is encouraged. Maintaining a healthy body weight is intertwined with these lifestyle modifications. By adhering to the aforementioned recommendations, individuals can achieve an optimal body mass index, BMI, ranging from 20 to 25. Pharmacological interventions, especially statins for lowering LDL cholesterol levels and medications for managing hypertension or diabetes, are prescribed based on individual risk factors. In conclusion, a multifaceted approach encompassing dietary changes, physical activity, smoking cessation, and weight management is pivotal in mitigating cardiovascular disease risk. Consistent adherence to a heart-healthy lifestyle can significantly reduce the likelihood of developing cardiovascular conditions. Remember, your health is your greatest asset. Stay tuned for my next video, where I will elaborate on controlling blood pressure and preventing its adverse effects on the body. Be well and take care of yourselves.